Can Wegovy cause panic attacks? It's a question we're hearing more and more as GLP-1 treatments become increasingly common. Let's look at what the evidence actually says. Before we dive in, this video is for general information only and does not replace advice from your own healthcare professional. Do not start, stop, or change any medicines without speaking to your doctor first. So, what is Wegovy? It's a prescription-only GLP-1 receptor agonist licensed by the MHRA for chronic weight management in adults living with obesity or overweight alongside weight-related health conditions. It works by mimicking a naturally occurring hormone called GLP-1, which helps regulate appetite and feelings of fullness by acting on the brain's satiety centers. Your clinician or pharmacist will advise you on exactly how to use it. Now, can it cause panic attacks? Based on current evidence, Wegovy does not appear to directly cause panic attacks. Panic attacks are not listed as a recognized adverse reaction in Wegovy's prescribing information. The large STEP clinical trials, which included thousands of participants, did not identify panic attacks as a significant adverse event, and psychiatric side effects occurred at similar rates between the semaglutide and placebo groups. However, and this is important, there are some indirect pathways worth understanding. Wegovy's most commonly reported side effects are gastrointestinal, nausea, diarrhea, vomiting, and constipation. For some people, these physical symptoms can feel distressing, and that distress may trigger anxiety or, in those already predisposed to panic, a panic attack. There's another factor too. An increased heart rate is a recognized class effect of GLP-1 receptor agonists. Some people may experience this as an awareness of a faster heartbeat, and for some, that sensation alone can set off a cycle of anxiety. Insomnia is another side effect some people report. Poor sleep is well known to affect mood and anxiety levels, so disrupted sleep could also play a role. It's also worth knowing that GLP-1 receptors are present in various regions of the brain, including some associated with mood regulation. However, any direct link between Wegovy and emotional processing remains hypothetical at this stage. It hasn't been proven in clinical studies. Individual susceptibility matters here too. People with a history of anxiety or panic disorder may be more vulnerable, and the relationship between weight management treatment and mental health is complex. Metabolic changes during treatment can affect mood in ways that aren't always straightforward. If you're taking Wegovy and you're concerned about anxiety or panic symptoms, speak to your doctor or healthcare professional. Ask whether side effects like nausea, an increased heart rate, or sleep difficulties could be contributing to how you're feeling. They may be able to suggest management strategies or consider whether any adjustments are appropriate. And if you have a history of anxiety or panic disorder, it's especially important to flag this with your healthcare team so they can monitor you appropriately. You can also report any side effects through the MHRA's Yellow Card scheme at yellowcard.mhra.gov.uk. When should you seek help urgently? If panic attacks are persistent, worsening, or beginning to affect your daily life, contact your GP or call NHS 111. If symptoms are severe, including chest pain or difficulty breathing, call 999, and if you're ever at risk of self-harm, please seek urgent help straight away. So, to recap, Wegovy does not directly cause panic attacks, but some of its side effects, including nausea, increased heart rate, and insomnia, may indirectly trigger anxiety or panic in people who are predisposed. The evidence for a direct link to emotional processing is not yet established. If you're experiencing any of these symptoms, speak to your healthcare professional. They're best placed to support you. Got questions about Wegovy or other GLP-1 treatments? Drop them in the comments below. If you found this helpful, give it a like and subscribe to the Bolt channel for more medically informed content.